Hi, we're here with Dr. Stephanie Buehler at the American Psychological Association's annual meeting in Hawaii. And we're here to talk with her about her new book, What Every Mental Health Professional Needs to Know About Sex. So thank you so much, Dr. Buehler, for joining us.
Thank you.
Yeah.
Thank you so much.
Absolutely. So the book just came out today. As we speak was the first day of publication of the book, so we're really thrilled to have the book out and have you talk with us about it. So, Dr. Buehler, can you talk to us a little bit about what was your motivation for writing this book for professionals?
Well, I knew that there were other books out there on the topic of sex therapy and how to do sex therapy. And I also knew from my own experience of learning to be a sex therapist that the books were often edited, and in other words, many chapters, multiple chapters, and that they came from many different points of view. And even though I, as a psychologist, I was familiar with many different theoretical backgrounds, I found it very hard to learn about sex therapy. What I really wanted, I wrote the book that I would have wanted, in other words.
Yeah.
So what I would have wanted as a person trying to learn how to do sex therapy was a book in one voice telling me rather concretely what to do, what was necessary, what were the necessary skills, what was the necessary information for me as a psychotherapist to conduct therapy with my clients and help them have better sex life. So that was really my motivation. I thought, well, I wanted something that was of one piece.
Right. Coherent, with a singular voice type of book, which are the kind of books that are really going to most benefit, I would think.
That's what I think. Just having one person telling you from beginning to end, and that's really what I do in the book. I start out with the sexuality of the therapist because what research shows us is that therapists tend to be more conservative sexually than clients, and we have our own sexual wounds and experiences that we bring into the therapy room. So I start there and just talking about how to become comfortable with this topic of sexuality. I mean, we kind of make an assumption when sex therapy is taught in school that everybody sitting in the room is comfortable because we're therapists, but I don't think that's true at all. So that's where I start, is helping therapists think about the topic of sexuality. And then I go into how to do an assessment and really take a really good, thorough ecosystemic assessment or history. And then I talk about common sexual problems that men have, that women have, and couples. And then in the latter part of the book, I go into the not so common problems, but they are things that show up in the therapy room. So I talk about LGBT issues, sexuality and mental health, sexuality and physical health, chronic illness and cancer, alternative sexual lifestyles, and what is commonly called pornography addiction. So, and more. So it's wide-ranging.
And I think the wide-ranging nature of it is really going to one of the key benefits of the book, one of the key features of the book. What would you say you intend to be the 2 or 3 key takeaways, if you will, for the reader of the book? When the person has gone through and read the books, what are the key things that you hope they will walk away with once they've read the book from cover to cover?
Right. Well, I would say one of the primary things is that I want people to feel confident that they can ask their clients about sexual issues. We know from research that people want their physicians, and we can extrapolate that they want their therapist to ask them about their sex lives. So I want the therapist to feel confident that if they do ask, whatever answer they get back, they're going to be able to attend to it and do further assessment and figure out how to help the client. So that would be one point. The second is that they'll know how to take an excellent, very thorough assessment. The ecosystemic assessment is a great one because it becomes an intervention in and of itself. As a client starts to talk about so many different aspects of their sexuality that they've never talked about before, and it helps the clients start to put together all of the influences on how their sexuality developed. And I would say the third is that when some of these more unique problems come in, the therapist isn't going to feel like a deer caught in the headlights, that they're going to have read about it, heard about it, and you know, even if they're not going to ultimately be the person who treats that problem, they're going to be able to listen with compassion and non-judgment, which are critical in helping people talk about their sexual issues.
That's wonderful. In the process of writing this book, which obviously some of it you take from your own practice, some of it you've had to do research on, you know, to get information, is there anything you think you learned in the result of writing the book, whether it was about the topic itself or about the writing process or anything else?
Yeah, that's a really good question. I think for me, the hardest chapter to write was the one on what we call commonly pornography addiction and or sexual compulsivity or hypersexuality. It was interesting to me because I really had to read a lot of literature to try to get a handle on what we were actually looking at. And for me, as a psychologist, the best fit seemed to be a behavioral addiction, but doesn't quite fit that either.
Right.
So I think this is an area that is still kind of a work in progress, an area where a lot more research needs to be done. And, you know, although I'd like to think that the book is definitive, it, you know, there's still parts that will evolve and keep evolving.
Right.
And, you know, as therapists, we have to keep abreast of those changes.
Right. Yeah. And you've made a really interesting point there, is that the chapter that you did on addicting or compulsivity, and how we need to learn more about it. I think, as we all know, the recent DSM-5 came out and did not include hypersexuality as one of the qualified things. So I think it's very interesting that there is a lot of, still a lot we need to learn about this topic.
A lot more that we need to know about it. And there seems to be some brain science that's coming out of, and you know, I know there are definitely researchers that are working in this area, and each one has their pet theory, but ultimately I think maybe in the next few years, hopefully in the next few years, we'll really know what it is that we're looking at and have some more concrete ways of intervening and treating someone that comes into our office with this issue.
Yeah. From what you've experienced and what you have understood from talking with and networking with colleagues in the field, what are some of the most common issues that clients present with that are related to some of the topics that are in the book? Or what are...
Okay, so so you mean the therapists, what therapists say comes into their office, or you're saying...
with the client? Actually, it's a great question.
What do clients come in with most of all? So I would say that the most common problem is what is commonly called low sexual desire, but really it's a mismatch of desires many times. You know, that you just have natural differences between people, and how a couple copes with those differences, where one's level of desire is higher than the others, is very interesting. It speaks a lot to other things besides sex drive, such as power and control in the relationship. And so those are issues that can be explored by the therapist. So.
Okay, that's really interesting. And finally, how do you see this this book